This is Tamara with BMed for the MiniOmni portable bone density scanner. So we are ready to scan a patient. Just to recap what we've already done, we've downloaded our software onto our desktop. We've unboxed the MiniOmni. We have the connection set up. And also we've done the daily quality verification check on the probe. So we are ready to scan the patient. Here is our patient, Christina. And for a new patient, you choose that first, and you would input and just simply type in their first name, last name. Their birth date is important, and their gender, and also their non-dominant arm is what you want to measure. So you ask them if they write with the right, then you want to measure their left arm. And so we've already inputted Christina's information. So we go back, we choose Christina, and before we're ready to measure, we need to know what to measure. So we're going to ask her to put her arm straight up, and we're going to rest the elbow, measure to the top middle finger, that's 41 centimeters. So the halfway point is what you will mark. And that is about 20.5 centimeters. So you simply mark that. Thank you. Set that aside, and you're going to finish the mark to the top of the arm all the way around, about 10 a.m. to 2 p.m. there. So you're done with the measuring tape and the marker. That's it. And then you want to have the ultrasound gel, just a couple of strips, the length of the probe on the top of the arm, as well as on the ultrasound probe, which I've already done. And as a reminder, you want to clean the probe later with a simple alcohol wipe or a tissue, not the Clorox bleach or anything like that, and you'll be good to go. So we are ready to measure. You simply take your ultrasound probe here, and I'm not going to press start yet. For the measure, we're always choosing the radius here is the preferred method with the MiniOmni. And there's also a refresher video if you need that in the future. So before I press start, I want to just recap the pointers on how to hold the probe. You want to hold it near the bottom, the base, with your two fingers on either side and your thumbs near the bottom as well. You want to also rest your hands on the patient's arm, and you want to consistently measure the patient with the probe on the skin, maintaining contact and a consistent coupling with the skin. And you want to rotate all the way over, and similar to a car going over a hill, you want to maintain the same pressure throughout, from beginning to end, 100% contact the whole time. So you may have to even look over on that side. You don't want to lift up the probe at all, and you're going to finish 3 complete cycles. So we are ready to start and measure. You have a visual probe, 0% to 100%, and you are going to listen for the beeps. So we're starting our first cycle. We're pressing start. We have a visual there, probe, 0% will move to 100%, and also we are listening for the beeps. That was one cycle. And we ask, is the patient okay? Everything is good?
Yes.
Okay, so we're ready to do the next cycle. Another cycle, maintaining consistency. We're ready for the third cycle and final cycle. Great, so that's it. We finished all 3 cycles, and our next step will be to simply press results and look at the summary measurement report, and we'll explain that in the next video. Thank you for visiting us, and we'll see you soon.